My name is Walton Magnus. I'm a freshman here at Tech, and I did my problem-solving speech on obesity. So the purpose of my speech is to inform you of potential solutions to combat the obesity problem worldwide, but I'll focus mainly on obesity in America and use statistics from America because it applies more to us since we live in America. So what is obesity? The CDC defines obesity as a complex disease that occurs when an individual's weight is higher than what is considered healthy for his or her height. Obesity affects children and adults, so everyone, and many factors can contribute to obesity, including eating patterns, physical activity levels, and sleep routines. Genetics can also play a role, and taking certain medications can also increase your weight, but it's rare. So Baylor University states that obesity is determined by a formula that uses height and weight to produce a body mass index, or BMI. So obesity begins at a BMI of 30, which is just normal obesity, but then anything over 40 BMI is considered morbidly obese. Anything between 18.5 BMI and a BMI of 24.9 is considered a normal weight, and then BMI of 17.5 or less is considered anorexia. So 1 in 3 Americans are considered obese, which makes it an epidemic in America, according to the CDC. So problems that are associated with obesity, there are a lot of health problems, and the CDC has a list. And all of these health problems can be causes of death, which include high blood pressure or hypertension, high LDL cholesterol or low HDL cholesterol, high levels of triglycerides, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, which is a breakdown of cartilage and bone within a joint from carrying around excess weight. Sleep apnea is a result. Breathing problems, many types of cancer, low quality of life, obviously. Mental illnesses such as clinical depression, anxiety, and other mental disorders. Body pain, and difficult with just normal physical functioning throughout the day. So out of all these, the most frequent diseases are cardiovascular diseases, which are like heart diseases. That's followed by strokes, then diabetes, and joint degradation, and then cancer is at the lowest portion of that list. Researchers estimate that obesity and its accompanying problems are responsible for at least $190 billion in direct annual healthcare costs, which drives up insurance premiums for everyone, not only obese people, but non-obese people too. So this disease affects everyone. So how to reduce obesity? Some obesity has medical causes which can be reduced by just going to the doctor, getting a prescription for pills, anything like that. But most cases of obesity are a result of a personal decision by the obese person. From 2010 to 2012 alone, every single age group has increased snacking, which is a huge part of why Americans are obese, because we're eating constantly. So if we cut down on snacks alone, that's a lot lower obesity rates. Dieting and exercise are obviously going to help reduce obesity, but in order to do that, we need to instill healthy lifestyle choices. Smaller portions are a good way to diet. Just stop eating when you're full. An incentive for being non-obese is obese employees get charged higher insurance premiums by insurance companies, so it costs you more money if you're obese. Uh, Having support groups in your community is also a great way to reduce obesity. And governments should require warning labels on unhealthy food, stating this could cause obesity and how much you should eat, things like that. It's also very important for schools to serve healthier food, and parents need to teach their children early on about obesity and how to avoid being obese and just healthy lifestyles overall.